Welcome back to the Ink Strategies YouTube channel. If you haven't already, please like and subscribe to our YouTube channel so you can stay up to date on the latest videos we release, where we discuss all things medical aesthetics and elective healthcare with individuals from across the spectrum. Today we have a very special guest on the Face to Face podcast. I'm going to introduce you to Farzad Nahai. Dr. Nahai is a board certified plastic surgeon who's been in the Atlanta area since 2004. I've got to work with Dr. Nahai in several different capacities and found him completely enjoyable, and I always enjoy his perspective on the plastic surgery industry. So without further ado, let's jump into this fascinating world of plastic surgery. Please help me welcome Dr. Farzad Nahai. We were talking with your manager earlier about kind of where we met. Where did we meet? Like, where was our introduction?
I got to think that it was at my previous practice.
Okay.
Over what formerly known as Pace's Plastic Surgery.
Right.
We were at a point where we were looking for some, advice about how to make things better. And at that time, you were, the company you worked for kind of would lent you to us, or allowed us to work with you. And I think that's where we met.
I think so.
Yeah.
Yeah. And then we had some other. I think you were part of the Philip Langston's group. Who was running that.
The multi-specialty. Yes. The multi-specialty meeting that we did with Phil.
Yes.
I really liked working with Phil. We had a good time. I think we had maybe a 6-year run where we put that meeting on, and we had done. Sometimes we had it in Atlanta. A couple times we did it in New Orleans. That was a fun group to work with, and a fun meeting to put on, and that's right. I think you were helping us out with that and being a part of that too.
So we had a few dealings. So when I first came to Atlanta, and when I first got into aesthetics, there are names that pop up. Mm-hmm. Right? There's these names like Paces, big name in Atlanta, right? Yeah. Nahai, your father, esteemed professional, and they call it Hester, those types of things. When you came up, was there ever any doubt that you were going to go into plastic surgery?
Oh, good question. I get that a good bit.
I bet.
I had a unique, my path was kind of unique in that when I grew up, you want the long answer? You can get the long answer.
Yeah, please.
When I grew up, I thought that all doctors were plastic surgeons because, my dad was, Dr. Nahai, and I just thought that if you had a doctor in front of your name, you were a plastic surgeon. And I think just at an early age, fortunately, my parents never said this is what you have to do, because I think probably if they did say something like that, I probably would have gone the opposite direction. But I think it was more of, in those days, my dad would bring slides home, and he would be working at his desk with the slides, and I'm 5, 6, 7 years old, and I'm just walking in his office to say, hey, and then he's got these pictures, and I found them fascinating, right? And a lot of them are intraoperative photos. And so a lot of it was just, anatomy on display, things that maybe for other people would make them cringe a little bit, but I found it fascinating. And I think fortunately through high school, science and math was came easy to me, but I was good at science and math, which, as a prerequisite for medical school, at least in those days, I think you had to have a certain proficiency in science and math. And I always just kind of, looked up to my dad and found what he did in plastic surgery very interesting. Being able to see anatomy, work with your hands, always found that interesting to me. And so even when I started as a freshman in college, I was pretty sure that med school and plastic surgery was going to be my future. And when I started to answer the question, I thought that was true for everyone. Like, I thought everyone, that by the time they got into college, they knew what they were doing. Whether or not it was business, law, computer science, whatever field it was, I thought everybody knew. And it wasn't until I started making friends and hanging out with my buddies that I'm like, well, wait a second, you don't know. And then it made me feel, in a way, pretty fortunate, because I saw a lot of my friends go through the process of wondering what they were going to do and searching for something that they were interested in and passionate about. And so when I think back to the choices that I made and how I got into plastics, there's a feeling of being a little bit lucky that I knew what I was interested in at an early age. and now the same way is just that I feel still as interested and as passionate about what I do, so that I look forward to my day and my week and what I do every day still, which is nice.
I think the one thing that when you're exposed to places like Emory and places like Paces and doctors like yourself, and once you are in a position where you can look at the entire medical aesthetics industry as a whole, there is something that pops up very quickly that an outsider does not understand, which is this idea of board certification.
Yeah,
okay.
sure.
To me, it was shocking to understand this ecosystem of board certification. Can you explain to the average consumer what's the difference between a board certified plastic surgeon and a board certified insert whatever, cosmetic surgeon, aesthetic surgeon, something like that?
Yeah. So there's a process behind any training that you do, whether or not it's cardiology, transplant surgery, plastic surgery. You go through a certain amount of training, right? So there's the medical school component, and then there's the residency component. And at the end of your residency, let's just say it's plastic surgery, you've trained a certain amount in plastic surgery specifically. And that means a certain amount of time, a certain amount of cases that you've done. And the board certification part it's almost like verifying your training at that point. So that by the time someone who's in plastic surgery can come out and say, hey, I'm a plastic surgeon and I know what I'm doing. Right. That's the board certification part. That's the part that consumers need to understand, is that okay, just because you have MD at the end of your name doesn't necessarily mean that you're qualified and verified to do the things that you say, unless you actually get that certification to do it. So, and I think in the plastic surgery world, it's a little different, right? On paper, because I have an MD, on paper, there's nothing stopping me from saying that I could do open heart surgery.
Right.
But what is realistically is that all those procedures occur in a hospital setting. All the neurosurgery procedures occur in a hospital setting, and the hospital takes those steps to check and make sure that this physician coming in is actually qualified to do what they say they're doing, right? So obviously I can't walk in and say I'm actually qualified to perform heart surgery. Sure. But because in the plastic surgery world, a decent amount of those procedures can take place in freestanding surgery centers, can take place in the office. There's not that same check and balance that you have where, for instance, for me, I maintain my hospital privileges at 2 different systems within town, actually 3. And I have to re-up every couple of years. I have to re-up that certification with the hospital to fill out the form. This is the things that I do. This is how I'm certified to do it. And then it has to go through a check and balance on the hospital side. Doesn't mean I can't, I can still do what I do in my office, but there's that check and balance where some people in that cosmetic surgery world may not have done a plastic surgery residency, may not have done that training, didn't go through the board certification process to verify that, okay, just because you did the training, did you actually retain that, and can you actually practice that information and medical practice that you say you can? Because they don't have that, this is how people get away with going to take a weekend class in liposuction or some sort of weekend course in whatever, and then they come back and say, oh, well, I'm board certified as and I don't want to disparage any other medical practice, so I'll just say it's another medical field, right? I'm board certified there, and I took a weekend class, and I can do your liposuction in the office, and there's no checks and balances to stop that.
Right.
And that's why there's been a push for quite a while to educate the public and say, look, you need to be looking for someone who's not only board certified, but board certified in plastic surgery specifically.
Right.
Because there's a big difference there.
I mean, I found it so interesting because I took a deep dive onto this whole board thing, because to your point, there's this thing called ABMS, American Board of Medical Specialties, which is kind of like the governing body of all the specialties that we all know about: family practice, dermatology, neurology, all the ones that we know and love. There are a few that just aren't on there, but you can still go get boarded. And I took a deep dive in some of these, and they shall remain nameless. But again, to your point, show up for a weekend, pay us a few $1,000s, and you'll be board certified in this really cool name. And the
Yeah.
thing is, me and you could start a board right now, and we
Yeah.
could come up with a
Yeah.
cool name.
Yeah.
And it's very scary to think.
It is scary. Well, think about like when you get on an airplane, you have a pilot that's got a license. That license has been verified. They have to maintain their license. They get tested on a, I don't know what the frequency is, but they get tested.
Oh, yeah.
For probably more stuff than most surgeons get tested for. And so that way, you know, when you get, we're in Atlanta, and you know, when I get on a Delta airplane, I feel pretty confident and comfortable that the person who is, you know, flying that plane is qualified to do it. Yeah. And that's the same thing that people need to approach when, especially in the plastic surgery world, because it's a little bit less regulated. There are certain checks and balances that are in the other surgical specialties and medical specialties that are not as present in the plastic surgery world, and that's where you just have to be careful and watch out. I tend to think, you know, Jonathan, like here in 2024, I think it's a little bit better nowadays than it used to be. There's a couple prominent, some of them actually been local. I mean, prominent news stories.
Oh yeah.
And I'm going to get some of this stuff wrong, but there was the dancing dermatologist, the dancing doctor or whatever. There was a dermatologist that was doing procedures in the operating room, and of course she's flashing stuff up on, you know, social media and stuff like that, and then, you know, finally gets in trouble because unfortunately, as a patient, you know, someone gets injured.
Yes.
And we hope that we can reach a point where it doesn't take that, right? It doesn't take someone getting injured to raise the alarms and the red flags, but sometimes, unfortunately, that's how it works. But there's several stories like that I think maybe the well-informed patient is a little bit more aware of these things now than it was 15 years ago. I don't have data to support that.
It's anecdotal.
But it's more of maybe just a feeling or a sense that I get that it seems to be a little bit better now, and maybe that's just my internal optimism or just hope that it's better.
In the world of plastic surgery, obviously it's evolving. You've been in it for a while. I've been in it for a while. What have you seen since you started to now that's kind of been the big trend that's pushed things?
Oh, wow. Gosh, do you want to go back to 2004? There's a lot to cover there.
Yes.
But if you're looking more specifically at let's say procedures and interventions specific to the aesthetic world, by far and away injectables, you know, has just grown, I mean, huge amounts.
Yes.
Especially if you think back to 2004. Yeah. What we have available to us, right, the tools that we have when it comes to toxins and fillers has grown a significant degree. And if you look at just from a numbers point of view, I was actually just looking at the ASAP's numbers from 2022, procedure numbers, injectables and whatnot. I mean, that's one thing that has just grown enormously. Right. And to the patient's benefit. I mean, there's so much more that we have available to us practicing within the aesthetic space that we just didn't have before. And the awareness of the injectables has grown a huge amount. I think that the maybe the perception early on about this was something that I had to keep quiet or keep to myself or wouldn't talk about in a public setting. You mentioned being at a dinner party and that sort of stuff, where that was probably less in the past, and that's not just injectables, that's surgery too. I think fast forward to 2024, to openly talk about injectables, aesthetic interventions, whether or not they're minimally invasive or surgically invasive, is now it's so much more in like public lexicon, and like the comfort level of talking about this is way different than it used to be. It's good for prospective patients because chances are, I hope, they get better information when people talk about things more openly. And then if you just think about from the business side of the practice, right? There's one side of the practice that's obviously, and this is what I tell the residents and fellows that I meet with, it's like you got to do really great work, and you got to be really safe in what you're doing, and what you're doing has to do what you say it's going to do. And so we got to practice safely, and we got to practice effectively. And but at the same time, especially being in the private practice world, what we're doing has to make sense so that I can keep the lights on and I can pay my staff and all that sort of stuff. So there's that component that has to be considered. And like for many of us that have been in the plastic surgery world since 2005, we've seen our practices grow with that. I guess the more the public accepts just talking about aesthetic interventions and their interest in looking fresher, looking younger, maintaining themselves better over time, it's helped in my world as far as like, keeping me busy and keeping the practice going and that sort of thing as well. So that's one big change.
Yeah. Which is, I would say that's the biggest.
That's the biggest. Without question, that's the
biggest.
biggest.
For sure.
But then if you look at, and I don't have a board here, but if you just look and sometimes I'll talk to patients about this in the office when they come in, and let's just say it's a very broad, open-ended discussion about facial rejuvenation, let's say. It could be the body as well, but a good bit of my practice is face. So I'll break things down and I'll say there's two main avenues that we have to address your goals. And one of them exists in this injectable space where it's just needles and there's no incisions and there's no numbing and it's kind of walk in, walk out, get a result that you then maintain over time. And then we have this other box over here where it's a surgical intervention, right? This is where we're talking about there's going to be some degree of anesthetic, there's going to be an incision, there's going to be a procedure, there's going to be a recovery to that as well. And then there's more, the other space that's growing is that in-between one. These are what we'd consider like minimally invasive procedures, where it may be needle sticks, think of, let's say liposuction of a small area in the neck, or think about energy-based procedures, radiofrequency energy-based liposuction procedures that are kind of in between what we'd consider non-invasive and what we consider fully invasive. That minimally invasive portion of plastic surgery has also grown to a significant degree. And if you look, when you just walk around at the meetings and stuff, and you and I go to meetings on a pretty regular basis, if you go look at the booths and you compare what you saw at the booths 15, 20 years ago and what you see now, there is a huge amount of effort put towards anything that can be minimally invasive, right? That patients like that, right? Yeah. I mean, I'll just take myself as an example. Like if there's something I can do that I can get a good, safe, reliable result with less invasive techniques, well, sure, I'm going to listen to that. Absolutely. And but the important part on our end is to make sure that we educate patients properly and that they understand there's risks and benefits to everything that we do. And the spectrum of risks and benefits that you take on with a surgical procedure versus what you take on with a minimally invasive, versus what you take on with a non-invasive procedure are different. And then we have to spend that time with patients to take a look at them and make them aware that, okay, there's certain physical findings I'd have on a person who's in his or her 30s versus someone who's in their 60s. And there's certain things that I can do for someone in their 30s that I can't do for someone in their 60s if we're trying to turn back the clock a little bit. So while I may have these minimally invasive and non-invasive techniques that I can do, whether or not that really applies to someone who's looking to improve their appearance and they're in their 60s, that's debatable. And so that typically is what will drive a conversation towards one of those options, be it the surgical option or the non-surgical option or the in-between one, with the kind of the minimally invasive one.
So the minimally invasive and the non-surgical, those are cool, right? But you're a surgeon. Mm-hmm. What's pushed the surgery envelope since you started? Has there been anything that's, textured implants were hot for a while. Fat transfers to the butt are big. It's like, what's been pushing that envelope?
You see things come and go
a
little bit, for sure. And so you mentioned the textured implants. That was, at one point kind of the new thing and pretty hot for a while. And then that's really tapered off to a significant degree. Sure. That's kind of a separate conversation as to why. But, I'd say probably starting 5 or 6 years ago, you could kind of just see that going down. I don't do many BBLs anymore. There's plenty of other people in Atlanta that do a lot of them and do a really good job at it. So right. I can't speak to that. But, we mentioned how plastic surgery is a lot more likely to be talked about in the press and at the dinner table BBL is one of the ones that, especially just in the state of Florida, has gotten a lot more awareness because they've run into some problems.
Oh, yeah.
And problems where patients have ended up getting injured in a very, very serious way. And some of these are by practitioners who are outside of that scope of board certification. Right. And frankly, some of it is even happening to folks that are board certified, because that there are risks with surgery, that certain risks that are there, no matter how good your hands are, no matter what sort of choices you're making, there's always an inherent risk. The same thing with getting on an airplane. You and I expect to get to the other side, but we know there's a chance you might hit turbulence. God forbid. I mean, these days, fucking doors are falling off. I mean, doors are coming off in the middle of the air. But it's an analogy that I sometimes use with patients just to remind them, like, all right, I'm a safe practitioner. I take safety very seriously, but we have to understand that there's still some risks that we're taking here. The push is to minimize those risks. So back to what you're asking about, what has pushed it. BBLs, I don't have my finger on the pulse on that, but if you just look in general, there's a lot more, into Florida's credit. They've put in certain safety features, like now you have to have an ultrasound when you do a BBL. There's only so much you can transfer. There's limits on how much fat you can remove and administer. So if you think about, and I do a lot of rhinoplasty, and in that world, there's a kind of open structure rhinoplasty, which is kind of the classic reductive rhinoplasty. And then there's a preservation rhinoplasty, which has been more and more popular, more and more presented at meetings, more and more talked about. I haven't personally performed one, but it's something that I'm watching to see, like, is this something that is really going to benefit my patients? Is this something that I want to adopt in my practice? I'm personally not there yet, but it's something to watch. And I think for patients who are on the web looking around, that's something that might pop up. Again, in the world of rhinoplasty, and we talked about fillers earlier, and this has been something I've incorporated into my practice as well, using fillers around the nose, right? Either to camouflage a little bit of a bump or improve the shape on the nose with fillers is something that's quite popular. It's growing a good bit.
I think it's amazing.
I've gotten some nice results with it as well. And oh, by the way, it's also helped with the post-op rhinoplasty patient who, things generally look really, really good, but there, if you can see a tiny little 1 millimeter, 2 millimeter thing here or there that you would otherwise probably doesn't bother the patient or the surgeon enough to do something about it surgically, but you say, oh, well, I have something I can take off the shelf, put a tiny bit in there, and it'll correct that little irregularity. And then, oh, by the way, because filler in the nose tends to last a really long time, you may not need to do that again for a year and a half, a much longer period of time than you would otherwise for using filler in the lips or nasal cheek or elsewhere on the face, otherwise.
I ask all plastic surgeons this just because I keep my own running tally. When you perform breast dogs, under the muscle, over the muscle, what do you prefer?
Now vast majority under the muscle.
Under the muscle.
Under the muscle.
Okay.
Yeah. When I started off, the majority were over the muscle.
Okay.
And there was a big push for that. And then I noticed in my own practice, and I think this has been borne out, this is a higher rate of capsular contracture. And that's hard to argue.
Okay.
And I saw it in my own practice. And then when I switched, 9-10 years ago, to going majority under the muscle, I saw my rate of CapCon go down significantly.
Interesting.
And so I've just kept it that way.
Okay.
And there's data that supports that.
I think it's a more natural look, don't you? I mean, as far as under the muscle versus
over the muscle has its benefits.
Yes.
I mean, it's less painful. It's a quicker recovery. I actually think it's probably a bit more natural looking over the muscle because the muscle's not impinging forces on the implant.
Gotcha.
I know that my patients tended to like that. I thought it had a really nice result. I think if anything, if you put up a Venn diagram as far as there's obviously crossover between under the muscle versus over the muscle as far as a natural look is concerned. But I think if you had any tendencies towards a less natural look, it's probably with the implants that are under the muscle versus the ones that are over the muscle.
Interesting.
Yeah.
Interesting. What would you tell a new plastic surgery resident that's about to come out, about to join whatever, a private practice, a hospital? What would you tell them in this setting?
Oh, there's a lot there.
I know, right?
Several.
Let's say they're going to bite the bullet and go into their own private practice.
Their own private practice. Yeah. Wow, solo.
A solo.
Yeah.
Yeah.
I think a few things. One of the deficiencies of residency is they don't teach you the business side of running your own practice. And I would highly encourage anyone, coming out to study up a little bit. I mean, maybe your family owns a restaurant, maybe your family has a business, and I would lean on some of those people that are either family members or friends that are in the business world and talk to them about, how do I read a contract? How do I look at a lease? What sort of cost on a lease makes sense for me? How do you hire someone? How do you fire someone? Oh, yeah. How do you, your insurance, how do you, there's so much to talk about.
How do you read a P&L? What is this thing?
But, and to spend time with that, that's where there's probably benefit to join a practice that's already established, right? Because presumably in an established practice, many of things are already extant, they're already there. There's someone there that's already thinking about those things for you. But if you're going to go solo, I mean, pay attention to that side of it. You're going to get hit with so many reps coming into your office as soon as you open your door. I've got the next, latest, greatest fill in the blank, right? Laser, box, device, whatever, and they will want to sell you everything. And sometimes there's an impulse to say, well, I need that device. I need to have this because my patients want it. Sure. Or someone else in my town has it and they're doing really well with it, therefore I need it. So especially early on in practice, don't get caught up in get one device, sure, get something that you're familiar with and that you know that in your area, patients are gonna want and seek that out, but don't spend big money on a bunch of devices early in your practice because you can very quickly get into trouble with that. And there's a benefit to waiting, seeing what your patients are interested in, seeing what you're comfortable with, making sure that you're proficient at it. Is this something that you need to run yourself, or is this something that can be run by another person in your practice, right? An esthetician or an RN or a PA. Is so much to consider when it comes to capital purchases like that. But that's all one thing. The thing I constantly tell residents and fellows coming out is number one thing you can do is just always do great work.
Yes.
Always do great work.
Great advice.
There's nothing that's going to replace that. And that's the one thing that over time will consistently serve you well. And you will get returns on that always. 1 year later, 5 years later, 10 years later, 15 years later, is always doing good work and doing the best you can for your patient. And that's probably the best advice I could give, honestly.
How does a busy plastic surgeon, busy as you are, and what do you do outside?
That's such a good question, because people are different. And I think I'll even say it. My dad's generation, and my dad in particular, is a little bit different as far as what recharges you and what makes you feel fresh about coming back to work. And so for me personally, I need a break. I love what I do, but once I leave this office or leave this building, even though I'm still basically on call for my patients. If I'm in town, I'm on call for my patients. So knowing that, there's times I have to set aside where I can turn off. Being at home with my family is one of the ways that I can do that. My wife's a great cook, so I cannot even stand up to what she does. But if I can at least just spend some time with her and I can help in the kitchen, and if it's just cutting up vegetables for the salad, there's a certain joy to that because it's kind of relaxing for me. For sure, working out. I just have basically a gym in my garage, so if I can just do push-ups and sit-ups and some pull-ups and get on the elliptical for a little while, that's a great release. If anything on two wheels, so if it's a bicycle, a mountain bike, a dirt bike, anything on two wheels, I get a lot of joy out of that.
Motorcycle?
Oh yeah.
What are you doing?
Yeah.
You're going to hurt yourself.
I even debated whether or not I should mention it here. But
okay.
No, it's true.
Yeah,
I mean, I've been riding motorcycles the majority of, since my early 20s.
Yeah.
And
I have to top myself out every year.
But the thing is, Jonathan, I'm 53. I've got nothing to prove to anybody, especially on a motorbike. So I'm the guy who's going to be, pretty darn safe. I'm not out there to go, let me show you how many wheelies I can pop. I'm not out there to say, well, let me see how fast I can take this corner. Definitely have fun. And the other thing it does is I'm blessed in that, I grew up in Atlanta, and I've got some of my closest friends from high school that are still here, and they also ride. And so it's the riding, and then it's also, that's an opportunity for me to be with some of my closest, longest friends that I've had in my entire life. The other thing that I've learned is like have a small workshop in my garage, and if it's woodworking or if it's just fixing whatever, if I have an opportunity where I can work with my hands and the stakes are really low, meaning that like when I'm working with my hands at the office, the stakes are incredibly high.
Sure.
There is very, very little room for margin for error. Sure. But at home, if I'm, making something out of wood and I miscalculate a measurement, okay, and then I get another piece of wood and I just do it again. And so that is incredibly relaxing for me to be able to work with my hands, but with very, very low stakes.
Oh, yeah.
That I enjoy a lot too.
I'm with you on the wood shop thing. I have my own little place I go.
So you get a hard time about working with a handsaw? I get all that.
I got a saw stop.
I get that. Oh, okay.
The one with that stop.
That's the other thing I get. Yeah. I get side glances. You work with power saws? Like, what are you doing? I'm like, well,
I'm not going to judge you that way.
I got to live, man. I mean, I got to do the stuff I enjoy, and I'll just do it, as safe as I can.
I understand.
And, that's just how it works.
All right. Well, thank you for your time. Where can people find you if they want to contact you?
I love spending this time with you. Thank you. drnahai.com. I mean, if you're going to go online and you want to look, www.drnahai.com. Okay. That's a great way to find it.